can see you, but I won't hear you until I bring you in. All right, we're just gonna wait a couple minutes so that we can get started. Like I said in my last stream that I did, notifications have been kind of crappy lately. So hopefully things get better and you guys can see when I'm on, because right now notifications are not working very well. I mean, I'm missing a bunch of notifications. People are not seeing my notifications go on. So I just want to wait a couple minutes to get started. I'm texting my sister right now to see if she got the notification. Hey, Alyssa. DJ Alyssa Divine, how are you? Thanks for joining us today. All right, well, at least I know that this is connected, right? Oh, thank you so much for joining us, Alyssa. I appreciate it. Yeah, okay, so you didn't get the notification. I'm gonna text my sister right now. So last time I was live and I was literally just like testing an area where I've never streamed before because I just wanted to make sure like everything worked and like the connection was good. And I got so many trolls and I had no moderators. So I'm like sitting there trying to stream and like had to like ban all these people manually, and it was not fun. So, okay, so Stream Elements is working. Okay, cool. Great. All right. Well, happy Thursday, everybody. Thanks for joining. For those of you who are rewatching this through our website or just rewatching it on Twitch, thank you for joining. Today we're going to be discussing well, I'll let Doctor inform you guys of what exactly we're going to be discussing, but it's going to be a conversation about cholesterol and preventing and hopefully helping to prevent diabetes. Dr. Millen has all like the 411 as far as like statistics and whatnot, but I'm sure that we can all say that we know or us ourselves deal with diabetes. I know that diabetes runs in my family, and so that's going to be like a question too. Mine is, what can I do to prevent this? Is it hereditary? Is it genetics? So we definitely want you guys to be involved in the conversation. So if you have any questions, please feel free to just comment in the chat, and we will highlight your question, and Dr. Millen will address it. So I'm going to go ahead and bring her in. As you guys know, I assist for her at her practice. I'm still going to have her introduce herself just so you guys can see, you know, how amazing she is. But you guys will see that when she comes on. And yeah, hopefully we'll get some more people in, but we are recording this and it will be available to watch again later. So if you have to leave or if you're just joining us watching the replay, welcome. All right, so let's go ahead and bring her in. All right. Hi, Dr. Millen. How are you?
Hi, good. How are you? Can you hear me?
Yes, I can hear you. So
good.
Just in case, you guys, of course, the gardener is here. the yard person.
The gardener.
So there might be some like if you guys hear some sounds, that's what it is. So they don't stay very long, but yeah. So why don't you go ahead and introduce the topic that we're going to be discussing today?
Hi, everybody. It's Dr. Millen, nurse practitioner from Lotus Integrative Health, and we're going to be talking about diabetes, cholesterol. I'm sure all of you know somebody who has diabetes in your family. About 1 in 10 people have diabetes. 1 in 3 people are pre-diabetic. So this is a huge issue in America and everywhere. I mean, this is global. We're seeing increase in diabetes everywhere. I also see in another, I've seen pregnant patients, and even in pregnancy, we're seeing more and more people diabetic when they become pregnant. And so this is something that's affecting young people to older people, from our, siblings to our parents to our grandparents. And so, all of us, I think if we're looking at a statistic of 1 in 3 people have prediabetes, pretty much all of us are at risk. And so I thought, let's talk about this. Let's talk about, how do we figure out what needs to be done? How do we figure out if we have it? And how to figure out what things we can do about it, and how do we make sure we don't get it? How about that? Because really, we want to move in a direction where we're not taking care of people after they've already developed diabetes and cholesterol issues. We're going to talk about cholesterol as well. It usually comes hand in hand. And once we start going down that road, it becomes really difficult to reverse. Though I do want to say it is reversible. And there's a lot of new data. It's not like you have diabetes. It's, it used to be this sort of diagnosis where people thought, oh my God, I'm going to be really sick. I'm going to be on dialysis, things like that. I think it is really come to being something that is potentially reversible. But of course, we got to know where we're at now, right? We don't know. We're not gonna be able to deal with it. So, chat. Definitely. Chat and let us know if there's questions you have about diabetes and cholesterol. I'm going to forge forward, Amanda, if that's okay. And I've got a little mini lecture, which is what we've been doing. I think in the beginning, we kind of talk a little bit about the topic as people get on, and then we kind of talk about it more, answer questions later. So
let me just let everybody know that if you do have questions, we really love any questions and engagement with the chat. So definitely shoot your questions in the chat. I can highlight it, and we'll be able to do, a Q&A as well. I have questions now too. Because at first I was like, what are we going to talk about? I was like, how are we going to? But I mean, even just you talking for 5 minutes, 6 minutes, I'm already like, all right, I got this question, I have this question, this question. So please feel free. We'll let Dr. Millen kind of give us some basic information, and then we'll kind of go from there.
So, one thing I want to talk about is sort of this new term, or it's not a new term for us, but I think patients are starting to hear about it. It's called metabolic syndrome. It's that combination of having insulin resistance or diabetes or sugar issues, whatever you want to call that. There's a different range of sugar issues that people can have, and then high blood pressure and cholesterol. So that's called metabolic syndrome. You've probably heard that term on TV. And really, we're looking at, is your blood pressure going up? Is your sugar going up? Are your triglycerides, which is a combination of fat and sugar, sort of, that's a number that you might get checked when you get a cholesterol test, and something called good cholesterol. And those are some factors. And then, are you big? Is your waist big? So those are some criteria we use to see if somebody might be in that category of metabolic syndrome. And usually when you talk about diabetes, you talk about cholesterol, you talk about hypertension, a lot of people have all of them. And that's because it's sort of hitting the same, having some of the similar issues, those issues in the body. And what are some risk factors for these diseases? We know genetics plays a part, and we talked about that last week when we talked about weight. We're genetically predisposed to be a certain body type or weight, but that influences how we metabolize our food and nutrients. Age is a factor. So of course, Amanda and I were talking about, is this going to be something that we want to talk about with people who are in their 20s? And like, absolutely, because I see people who are in their 20s who have diabetes and cholesterol already. And that means when you look at it from or even metabolic syndrome, why are we seeing these things? They're starting as kids. We're seeing diabetes in kids. Wow. So we are really needing to start early and earlier. And I know all the kids now, they learn how to read the labels. I don't know if you've seen that with your nieces or nephews or any kids you know, or if they're your own kids. In my time, we didn't read labels. We ate Fruit Loops, we had soda, and that isn't cool anymore, right? We know that all that sugar isn't good for us. But the
Right.
kids are learning to read the labels now. So that's a good thing. And that is a risk factor, what you're eating. But your age, your gender, your genetics, your family history, those are all important factors. If you're using alcohol, drugs, smoking, those are important factors that are going to predispose you to sort of hypertension, diabetes, and cholesterol. Not exercising, that's a big factor. Or moving, we want to call it, actually now the new way to term it is movement, because we know that you don't have to exercise like crazy. I mean, I know we feel like we have to, and we talked a little bit about that at the last time, that we could be, hiking. We've seen people who are athletes who get strokes or heart attacks, right? In the news. And so there's something there that's going on inside their body on a cellular level. They may be exercising, but there's some issue with their cholesterol.
Right.
And then inflammation. And that's a new big thing too, is looking at, and we talked about in our first talk, we talked about the gut. And so like I said before, and I'm going to say it every time we talk about things, everything's connected. Everything's connected. And when your gut is inflamed, you have bacteria, your microbiome's off. Those inflammatory markers, that inflammation is also coming from your gut to the rest of your body.
Oh, wow.
And we're going to talk a little bit about how your gut and your oral hygiene and your gut can actually cause heart attacks and strokes. Isn't that weird? That's amazing.
It's weird, but I'm not surprised because I feel like I learn something all the time from here. So
there's always something to learn.
Lots of other people are. I know.
There's a big joke in my family. I never stop learning. I've been learning for years. I think, I just finished my doctorate in nursing. And now, of course, I'm certifying with the Institute of Functional Medicine. Even in medicine, I mean, for us, we're constantly learning. We're required to have education. But, of course, I always end up doing more than that because things are changing. Things are always changing.
Definitely. Let me just go ahead and say hi to friends in the chat. Thanks for joining, guys. I have 3 moderators here right now. So my last stream that I did, you guys, I mean, it's nobody's fault. I'm like not expecting like mods to be there every single time, but I had so many trolls and I was like freaking out. So thank you guys for being here. We have Izzy, what's up, Izzy? Amanda Cortez, my sister Alyssa, SD Cakes, JJ. Thanks for joining again, DJ Alyssa Define's here. We have Vero. Happy belated birthday again. It's the whole week, so we're gonna keep celebrating. DJ Leo Rock, thanks for coming. I saw Betty in here. I just wanted to say hello. Jelly Gel, Marzoni, I'm Riri. Thank you guys for joining. I was talking earlier, I don't know like which. DJ White Matic, thank you so much for subscribing again. Wow, already going on my 2nd month of streaming. Thank you guys so much. Thanks for supporting the stream. Thanks for hanging out. We are here to answer and, discuss some health topics, but just a reminder that, obviously the information here on our stream is it's more discussion and tips, but of course everyone should pay attention and discuss their own health with their primary doctor. And near the end of our discussion today, we'll provide you guys with information as well, because we do telehealth appointments here for those that are in the state of California. But yeah, just wanted to say hello. Hi, Trina. Thanks for joining. All right, so any questions so far? I know this is kind of like a very broad topic. Did you have more to add, Dr. Millen, or did you want to ask a question? Just a random.
Do you have a question?
Yeah, so my grandma, she does have diabetes. I'm not 100% sure like what type and whatnot, but I kind of just always grown up with her having it. She's had a couple of health scares because of it. Not really taking care of herself as well as she should have. But you know, it obviously was like a very big wake up call for her and us as a family. So this is my grandmother on my mom's side, and my mom and my dad. You know, they keep on top of their health, which I'm so grateful for. Of course, my mom's calling right now. Her ears must be ringing.
She knows you're talking about her. Yeah.
They're very, very like healthy. Like I remember like the year, maybe like about 10 years ago. Yeah, about that. Coming home from college and like, you know, expecting to eat, you know, my home cooked food and having leftovers from what my mom made earlier in the week of, you know, all the Mexican dishes and pastas and all of that. But, you know, there was a big change. Like they really switched when they got into their 50s and late 40s. Like my mom, like, and my dad mostly, Izzy, they really changed up their diet. And so, I mean, I'm grateful for that because obviously we could all use better diets. But I just remember being like, what is this? Like salad? Like what? But so I could tell that my mom and my dad are both very preventative as far as the health goes. But me, almost in my mid 30s. I'm 33. Obviously, like, you know, I should have a healthy diet, but what other preventative things can I do? Because it does run in my family on my mom's side. I mean, I know you mentioned, you know, movement and diet and whatnot, but I mean, how do I test for it? How do I know, like, am I on that path to it? Like, is it something that I can even prevent? I guess just recommendations on what would be really beneficial for me.
Right. Awesome. So, and that was exactly what I wanted to talk about next. So, you know, we know if we talk specifically about diabetes separately from the other metabolic issues, diabetes is sort of an issue of how we metabolize sugar. So when we're eating, of course, people think sugar means the white table sugar on their, you know, on their table. And sugar, when I refer to sugar, I'm talking about everything that converts to sugar in your body, which is carbohydrates. So that goes from fruit to grains to beans have carbohydrates in them, to, you know, ice cream, dairy has carbohydrates in it. So all of those things, your body, your stomach, that's what it does, is breaks it down to sugar. And when you take in too much sugar, your body has to release insulin. And when it releases that insulin is that sort of carrier that moves the glucose from the bloodstream into the cells. So when the cells are not taking in the sugar because the insulin isn't working, that carrier isn't binding to the cell, or when there isn't enough insulin, there's too much sugar in the blood. And so the number one test that we usually do is a fasting sugar. We tell people, get up early in the morning, go and do your blood work, and we'll see if your sugar level's high. Okay. Well, in young people, that may come out normal. You may overnight metabolize all your sugar and do a good job of it. And so one of the issues is that we in conventional medicine don't really do a good job of really making sure early on that people aren't glucose intolerant, we're insulin insensitive. And that needs to come from looking at insulin levels, which most places don't test you. You know, you can ask for a fasting insulin level. So if you're used to producing a lot of insulin to metabolize that sugar, your insulin level is going to be high. And that might be one of the first markers. So we're talking about early detection of diabetes, and we don't do that enough. Then the other thing is a 3-month marker. Your red blood, when you have a lot of sugar in the blood, then your red blood cells get sugared, or they get what we call glycated. And so you can also test what's called a hemoglobin A1C. And that's a test everyone's heard of. That test is sugar on your hemoglobin. And that is a 3-month marker of how long, how much sugar you've had in your bloodstream over 3 months. So that's another good test. And then, there's other, those are the 3 most important tests. There's some newer tests that are coming out, but those tests will be really good at detecting earlier diabetes. And even if your A1C, now usually we'll tell people, oh, if it's above 5.7, you're pre-diabetic. And I tell people, well, if you're 5.6, maybe you should think, oh, I'm moving into pre-diabetes. If your fasting sugars, 90 or 95. Oh, I don't have diabetes. Well, your fasting sugar should not be 95. You're on the borderline. So also being a little more liberal with how we look at those numbers instead of telling people, oh, you're fine. I want us as patients to remember that we have to be a little more aggressive and saying, hey, my grandma had diabetes. I want you to test me at 25. I don't want you to test me at 40. Right. I want you to test me at 20, 25. So that's one of the things, is identifying your risk factors and then getting tested early.
Okay. So I have a question from Beto 105, and then also there was a question earlier from our friend Izzy about good and bad cholesterol, and then Beto's asking about good and bad carbs. So is that something?
Let's talk about cholesterol in a minute. We're going to talk about cholesterol in a minute. Let's talk about carbs, because we're on the carb talk. Let's talk about carbs. And we talked a little bit about carbs last week. Last time we talked about intermittent fasting. We talked about scheduling your timing and how that lowers insulin. And now this is going on that idea of keto. A lot of people are on keto. We used to call it Atkins like 20 years ago when I started. I did the Atkins and I did lose a lot of weight then. But that was more of the idea of, oh, you can't eat any carbs, but you can eat as much fat as you want. And that's not good either, right? We don't want to be eating, fatty pork or, really, really fatty meats all the time. Mm-hmm. Now, when we're going to talk about cholesterol in a minute, good and bad carbs, what we're talking about with good and bad carbs is how fast that turns into sugar in your bloodstream. So when I eat a piece of candy, that's pure sugar. That goes directly into my bloodstream and my insulin goes like this. Whereas if I eat a piece of fruit, that has to be digested. It has to be broken down. And so it needs to be, or maybe a whole grain like oatmeal. And that gets digested and that slowly releases sugar into the bloodstream, or it gets slowly metabolized. So it doesn't cause the insulin level to spike. And there's ideas that this insulin level that's spiking is also causing our insulin level to just be high all the time. Mm-hmm. And that is a problem and what's causing weight gain. Mm-hmm. So this idea of good and bad carbs. Now, if you look at somebody who has, diabetes, then I would say most of our endocrinologists are going to tell you there's no such thing as good or bad carbs. All carbs are bad because you're diabetic, right? Mm-hmm. But now for us who don't have diabetes, what we want to do is eat those carbs that don't turn into sugar quickly. And interestingly enough, I think we call it glycemic index, where we rate how high the glycemic index is, how fast it turns into sugar. Mm-hmm. But you know what? That's different for me than it is you. Like somebody who eats oatmeal, they're going to be, nope, my sugar didn't go up super high after I ate oatmeal. Mm-hmm. Somebody else, they're going to eat oatmeal. That sugar is going to go super high and super fast. Insulin's going to go fast. So what's good and bad is actually relative. But in general, bad carbs would be our sugary sweets, things that turn into sugar quickly. And a good carb would be like a whole grain or oatmeal, or, fruit. That would be a good carb. In general, though, when we're talking about weight loss or diabetes, we really want to lower the sugar in the body. And to do that would be to really lower carbs. And that's where you get this keto diet coming into play, where a lot of people are losing weight with keto. A lot of people are reversing diabetes with keto. Wow. Of course, you want to be careful, again, If you're on medications, and again, we always tell everybody, talk to your provider when you're trying any of these things or discussing any of these things. The reason we bring this up is so that you're more educated. You can go and advocate for yourself and get the kind of care you deserve. And by telling your provider, whether it's a nurse practitioner or a physician, hey, this is what I heard. This is what I want to talk to you about. I want to go keto and I'm diabetic. What do you think? And if you're on medication, you have to be careful because those medicines are lowering your sugar. And if you're not eating any sugar, then what are they working on? So, you do have to be careful.
Exactly.
But I want to add one more thing to that carb note is that if you go on keto or if you are fasting, if you have some fat on your body, you have fat stores that will be turned into sugar in your body. So, people get worried about, oh, I'm not eating any carbs. Well, that's the whole point. If you don't eat carbs, then your body's going to burn the fat on your body and turn it into sugar.
Oh, we're going to have a whole other discussion on keto.
I think we're going to have to talk about keto separately. It's just too much. But they're all related. I always say that.
I know. Another quick check-in. Thank you, Audrey M, so much for subscribing. 2 months. Wow, I can't believe it's already been like a whole month, more than a month that I've been streaming. Hello, roses are red. Thank you for joining. JJ, hey sis. Any questions so far, guys? We want to make this as interactive as possible. Thank you for joining us. Just trying to see if anyone has any questions.
Somebody was wondering if keto works, and I said, yeah, keto can work. I think everybody's individual, and you have to check in with your provider. But if you have fat stores on your body, if you're thin, then why? But there's skinny fat too. I don't know if you guys have heard of skinny fat. Have you heard of skinny fat? People who are thin but actually have a lot of fat inside their body. I sometimes will get patients who are really super thin and their cholesterols are super high. Oh, and wow. That's called skinny fat. Like they have not a lot of muscle. They have more fat. They look normal, but there's stuff going on. And there's different presentations of this metabolic syndrome where you sugar, cholesterol, hypertension. Sometimes you see people who have diabetes and they're thin. We always think of people who are diabetic as being overweight, but we see thin people who have diabetes too. And so there's different presentations of metabolic syndrome and diabetes and hypertension. We can't assume, I get people who I'm overweight and people always ask me, oh, you must have diabetes or you must have hypertension. I don't have anything. You can see overweight people who don't have sugar problems or cholesterol, but being overweight in itself is a issue and causes inflammation and puts you at predisposition of having these things as you age. So, it is important to lose weight and we'll talk about keto next time. Maybe we'll talk about it in conjunction with intermittent fasting again, because I know that one was, a lot of people were interested in it.
Yeah. So, anything else that we can add to what we've been discussing, or can we, I guess, move into the cholesterol and how that coincides with diabetes?
Yeah. So, one of the things I wanted to add before we move, or actually kind of goes towards cholesterol too, is these things are brewing 10 to 15 years before they present. So really assessing your diet, your exercise, your risk factors are super important. And, for cholesterol, sort of similar risk factors, age, genetics, high ethnic groups. I know we have certain ethnic groups. My family is from India. South Asians have really high cholesterol issues. And yeah, I mean, just like in the Latino population, you see a lot of diabetes. I mean, there's certain populations that tend to have more of these.
I had no idea. Is it just because of their diet or genetics, or?
I think it's genetics plays a part. I think diet plays a part. The way you process, like I was talking about, the way you present and process some of these foods is important. Some people will have fatty liver disease. Some people will get diabetes. Some people will get, sort of obesity, and they won't have any other issues. So there's a lot of different presentations to this metabolic syndrome, and for ethnic groups are at different risks. So that's another thing you want to factor in when you're assessing yourself or talking to your provider. Hey, I'm South Asian. I know my, you might want to say, like, my husband's family, his dad, his uncle, there's this history of stroke and heart attacks. So, and then, if you have a family hit for cholesterol, really want to be careful if you have a family history of stroke or heart attack that's young. My grandfather died in his 50s, and, he had a complication from surgery that led to a stroke. And so, or that's what I heard. I don't know. Maybe of course the family history is sometimes hard to get, right?
Yeah.
The other thing that might lead to cholesterol issues is having inflammation. Again, we talk about inflammation with diabetes, inflammation with this. It's going to be also affecting hypertension as well. Kidney disease. A lot of young people get high blood pressure. Young women get high blood pressure during pregnancy. That puts you at risk for having cholesterol and hypertension. Menopause. And then, if you've had breast cancer, that can be a risk. Breast cancer radiation, actually. So those are some of the issues that might cause cardiovascular disease and cholesterol issues.
So how does cholesterol incorporated or lead to diabetes?
So what the way it's connected and the way we see it is when you have high sugar, it damages your arteries. And with what's the issue is usually you have a lot of sugar. So your body is trying to figure out how to store that as fat. So you have a lot of triglycerides running around. And then if you're eating a lot of sugar, you're usually eating a lot of fat with that. So it tends to be that diabetes comes with cholesterol issues. Not always, but and then if you have that sugar molecule in your artery and it's damaging your artery because they're quite big, and if you have a lot of them, and then you also have cholesterol running around in there, and it damages these artery walls, that plaque or that cholesterol, the cholesterol wedges into the artery walls. It weakens the wall. And then as the wall weakens, so it causes inflammation, and then it makes it even more permeable. And so then you get all this cholesterol in there, and then the sugar's running around. So then that sugar actually binds to some of that LDL cholesterol that's in the arteries.
I see.
And then because your body thinks this is a foreign invasion of some, material, you get foam cells that grab onto that cholesterol molecule.
Mm-hmm.
And then, it forms a plaque. And then that plaque is damaging the wall. You'll get a clot forming there. Mm-hmm. And then the clot dislodges and causes a heart attack or stroke, or there's so much damage to that wall, it splits open and causes the artery to pop. So that's strokes, heart attacks, sort of in a nutshell, how cholesterol and sugar combines into that. Sorry.
And it's a lot of talking.
Well, and I had to think about, this is what's happening. It's like this cascade.
So for those of you guys just joining, welcome. Thank you so much for hanging out with us. I see Nikki on Vegas. Hey, girl. Danny, we spent so much time together yesterday. It was so amazing. On such amazing streams. OG Raji, thank you for joining. DJ Whitematic, and thank you for getting that subscription earlier. Appreciate it so much. So we're just continuing our discussion with Dr. Millen. So please, if you have any questions or want to know some more information, please feel free to write it in the chat. I don't know. I always forget to have the link to the Instagram ready, but for those that don't follow, we are on Instagram and we post amazing posts, not only like health tips and facts and whatnot, but inspirational quotes, links to podcasts and webisodes, and just, things that help with our daily lives, whether it's health, whether it's mental health, whether it's wellness. So definitely follow us on Instagram. That's going to be at Lotus IHN. So it's at Lotus IHN. Thank you. Thanks. Yeah. So this is our third stream that we've done. We're trying to do something every other Thursday. So I think maybe for next time, I'll post something on my Instagram, just trying to get some feedback and what you guys are interested in finding out, or just topics that, you're interested in knowing more about, or have always wondered about. Somebody had mentioned, wondering if the keto diet really worked and how it worked. I mean, I'm definitely interested in it. It's going to be really hard for me to give up carbs because I just love carbs so much. But I need to work on my diet, and I need to, lose a couple of the extra pounds I have. So
it's a really hardcore. It's a really hardcore way to get to do weight loss, but it will reverse diabetes. I mean, if you go to a low carb keto diet, it will reverse diabetes, and I've seen it. I've seen patients who've lost 50 to 100 pounds.
Wow.
I've seen patients who had an A1C of 16 go down to 6, which is incredible. And that was one of the reasons I went to this more natural way of doing medicine, because I realized as a nurse practitioner, what I was doing, I was giving pills. Our conventional medicine, you have diabetes, you walk in, we give you metformin, and you're taking metformin, and then guess what? You're not getting better, because guess what? You haven't changed any of the things that are really risk factors for you. And your sugar just keeps getting worse. And then guess what? You can't, you suddenly have a cholesterol problem, you have a hypertension problem, and then we just keep giving you pills. And so this is really, lifestyle is number one, and I want people to be aware, because lifestyle starts early. I've got my kids having less milk, less gluten. Somebody wrote, I can't eat gluten. It's actually probably a good thing, because gluten's an inflammation, and again, when you look at cholesterol, we're looking at inflammation, So I know it's hard, because there's a lot of yummy things with gluten, right? Bagels and croissants and, pastries and all those good yummy things.
So much.
Sourdough bread. We gotta talk about sourdough bread. That's my thing, right? Sourdough bread. But it's really about diet, and really diet is, I think, even more than movement and exercise. Diet is key. So any other questions? Anybody's got?
I wasn't sure if this is a question for Dr. Millen or for Pedro. How does one bring down high inflammation markers?
Yeah. One is evaluating the gut, because the gut is causing a lot of inflammation in the body. So you're doing a dietary, you can look this up. It's called the 5R. I think it's the 5 R's. It's basically repair, oh man, I got to memorize that one. It's like basically a gut protocol, the way you clean out the gut, and then you repair it, and then you restore it. And you can go, maybe we can do a talk on that one. That way I can make sure I've got but you can look it up. That's one way to really decrease inflammation. Losing weight is a huge way, because if that visceral fat causes inflammation, your gut or poor diet, a lack of exercise causes inflammation. Chronic infections. We talked about your gut, your oral hygiene. The bacteria in your mouth go into your body and can go into your heart. Wow. And cause infections, can cause inflammation, and then cause a clot. So, because your body's trying to attack it and kill it. So, having good oral hygiene, incredibly important to reducing inflammation. And then looking for any heavy metals. I think I had you post that I did my test. I did my NutrEval test through Genova, and I had tin in my blood. And I couldn't figure out where's tin coming from. I don't eat canned food. I mean, we have a once in a while open a can of beans, when on a night where I don't want to make them. But
Uh-huh.
that's like once or twice a month. That's going to raise my tin level in my blood. And I figured out it's coming from my toothpaste. The
Wow.
tin is in my toothpaste, stannous fluoride. And I could not figure out where else I was getting tin. I don't eat anything with metal in it. And so looking at your ingredients, inflammation from, we've got to do a talk on makeup. Makeup has all this toxins in it. And having or beauty products, self-care products, your shampoo, all this stuff has toxins in it, which will go into your system and are polluting your body and causing inflammation. So those are the reasons you get inflammation. So trying to reduce all those factors are really going to reduce inflammation in the body.
Got it. Hi,
And then,
Vard. I see you in here. Vard was mentioning that he went on keto. It helped his inflammation.
yes.
And he had inflammation, and keto helped with it and dropped 30 pounds.
Yay. 30 pounds in 6 weeks is a lot. Wow.
That's crazy.
It's a little crazy. It's a little crazy.
But, was it a combination with exercise as well? No, someone said no bread and makeup. Sugar is the worst drug out there. I know it's so bad, but it's so hard.
It is.
I know. I have the biggest sweet tooth too.
Getting rid of your sugars is going to be really key to reducing inflammation, because that's a big source of inflammation, weight gain, and inflammation. So definitely, let's talk about things that you can do. I have a list here that I've written out that I want people to do. So we talk about diet a lot: decreasing carbs, decreasing your sugars, increasing your veggies. Rainbow. Go for the rainbow, not Skittles. Not the Skittle rainbow, the veggie rainbow.
Vegetables, yes.
And then, shop local, shop seasonal, shop, go. I mean, I know it's expensive. But the farmers markets are really reasonable, and you get such great tasting stuff. I think part of the reason we don't, I love eating raspberries, blueberries, full of antioxidants and nutrients. And those are if they taste good and they're sweet, it really fills that sugar need that we have, every once in a while. And so, somebody posted really good. Yeah, that's a good question. JJ,
what about honey? Like, I love honey.
It's sugar. It's sugar. You know what? And anything that, agave, honey, it's all sugar. It's all sugar. And now I have not had sugar in my tea. I drink tea every morning, decaf. I have not had sugar in, I think, at least 5 or 6 years. I just don't put sugar in any. I love Starbucks. I just get the unsugared. I get they used to have the sugar substitute one. I used to get that, but actually, sugar substitutes are also considered not good, and that is because they're mimicking. They might even be worse, and I'll tell you why. They're mimicking sugar. They give you your body thinks that it has sugar, and it raises its insulin level, but then there's nothing to process. So then you have insulin, and it's not even got anything to work on. So that is where sugar substitutes may not be good for you, or are not good for you, and they have recommended that you not have that as well.
Wow.
So stevia is supposed to be okay. I'm going to look into that a little more. Stevia's but the what is it called, NutraSweet and all of those. No, not good for you.
Somebody asked, what about alcohol?
What's alcohol?
We,
Sugar.
us on Twitch, we're home, but we're still consuming alcohol, and some of us are consuming even more alcohol from the comfort of our home. So somebody asked, what about alcohol?
Yeah.
What about in terms of like inflammation, I guess?
It increases inflammation. It's sugar. It's basically raising your insulin levels. And, I used to have one a week. I'm down to one or two a month now. I just have one or two glasses of wine a month, usually one, if any, because it just is really hard on your body. When you're young, you have a pancreas that's really vibrant, and I guess it can really metabolize things really fast. Your insulin can metabolize, but as you age, it becomes harder. And so, but it's not good. It's not.
Well, I mean, and the hangovers are worse. That's why I'm like considering slowing down on my drinking.
The hangover is just a sign that you're just not metabolizing alcohol, sugar very well,
Mm-hmm.
Yeah. And, JJ wrote, sugar substitutes are bad for gut health. Absolutely. That's the other reason. Thanks for mentioning it, JJ. Yeah.
Bad
sugar substitutes. Yeah. Bad for gut health. Bad for the bacteria in your gut. For sure.
Wow.
Great comment.
Oh man, I'm like reevaluating my whole diet now. Every time we talk about this, I'm like, oh, I feel so guilty. But I guess that's a good thing because we should be eating healthier. It's now that Alyssa's back home, I feel like I'm cooking more. When she wasn't, it was just so easy for me to just go pick up something to eat real fast. Now that she's home, I feel like we can, or I like enjoy cooking for us again. And so we're trying to, turn to back to healthier eating, I should say. So,
yeah.
I mean, besides missing her so much.
Aww.
No more sweets and snacks. Okay, well, when you were gone, I didn't have too many sweets and snacks. But I was eating out a lot. That's what it was. It's just, it's just so much easier to just go pick up something quickly. I know, Amanda said I can't eat any of my favorite stuff then. I know it's hard.
I think you can once a week, or I treat myself once a week to something, and I'm pretty much intermittent fasting and keto the rest of the week. I have very few carbs in my diet now, just because I've been overweight since I was a kid, and I want to lose weight, just like everybody else does. And really, and we talked about it in our intermittent fasting group talk. And I think that intermittent fasting and doing a combination of intermittent fasting and keto is really kind of the key to having that weight loss. And then really maintenance has to come from eating less sugar. I think that's where maintenance is going to come into it, doing a partial keto diet. So, but I think these are individual things. You have to talk to somebody, and you can give us a call and we can talk. I'm happy to talk to you about how to plan and how to figure out how to make it happen, and then really reduce those risk factors. So, hey, we didn't finish talking about sort of lifestyle. I think stress is a huge issue. How do we lower stress? We've got, I'm doing yoga every day and meditation, and that's been a huge help to me. Talking with friends and community, that's another big issue, is that obviously when we have love in our life, then we feel less stress, we have better health, and there's many studies that show that. If you have mental health issues, you have family issues, getting counseling is really important, because that stress is impacting our health. We talked about nutrition, we talked about exercise and movement. I also don't think you have to exercise like crazy. I don't think that's good for you either. I think that stresses the body out. So finding that sweet spot for exercise is really important. Sleep. When do we need our beauty sleep? We cannot recover from the day without sleep. And if you're not sleeping 7 to 8 hours a night, you're doing your body a disservice, because guess what? That's the time when the body reduces inflammation, takes care of, you know, takes care of business. And if you're not getting enough sleep, that's a huge risk factor for cardiometabolic disease. And we see that in people who work nights when they have disrupted sleep. And I have a blog out there on my website on circadian rhythms and when to eat, when to sleep. These are all going to impact inflammation and your risk for cardiovascular disease and cardiometabolic syndrome, diabetes, cholesterol. So having good sleep, having no phone time before you sleep, because the phone is stimulating those LED lights. Your timing, the length. If you have a pet in your bed and it's bugging you, you need to get the pet out,
Yeah.
And caffeine and alcohol are affecting sleep as well. So another reason not to.
Well, I know for us on the Twitch community, it's so hard because our favorite DJs, they're used to being up late and staying out late.
Yeah.
And, staying out, on Twitch till, 3, 4 in the morning.
Wow.
But I will say in the past 2 weeks, it took a long time. I will say it was not easy, but I had to just get over the fear of FOMO and missing out on stuff on Twitch, and turn it off. So actually for the past 2 weeks, no, I don't stay up until 2 or 3 anymore because I get off because it's so stimulating. And it's but it helped so much. I feel less stress, less anxiety. And I mean, even though I'm still going to sleep, around midnight or 1, I'm still getting, my 7 to 8 hours of sleep, and it's changed. I don't know. I just feel like the last 2 weeks I felt so much better. I don't get as tired, during the day, in the middle of the day. But I think we're all kind of getting used to it now too. It's been 4 or 5 months. So don't be scared about missing out on night streams anymore, guys. Take it from a survivor. I'm surviving, I'm thriving, and my sleep schedule so much better, which is making my work better, which is making my focus better. It's okay if we don't get it. Sleep is so important. It's important for our overall health. But it helped me mentally, physically. I just feel better. So yeah, don't be scared to miss out on a stream here or there, because sleep is very, very important. And yes, what Roses Are Red said, she said, FOMO doesn't pay or can't pay our bills.
I know.
Yeah. Right. I just feel I feel a lot better. It's already an uncertain time right now, still with the pandemic and everything. Yeah. So if anything, we should be more conscious and trying to make ourselves healthy physically to, help us mentally, vice versa. So don't forget to sleep, guys.
Well, and sleep is important for immune system. I mean, we really should talk about that as well. Our immune systems, we're entering winter and everybody's worried about COVID and the flu and, having more COVID cases. Sleep is so important on anything we talk about. Sleep and your digestion, so important, your gut. So, one thing I've noticed, I don't know if you've noticed this, when I don't sleep well, I'm hungrier the next day. I eat more.
That makes sense.
Because your body doesn't feel good, and then it's trying to use food to comfort itself, right? Because it's hitting that pleasure center in the brain. So, so sleep is really important. I think a lot of people commented on sleep. I was just looking at the comments here.
Well, I mean, most of us all stay up late on the Twitch streams. So
we're
all kind of adjusting now that it's been 4 or 5 months. And I'm not saying it's the same thing every stream, but I just don't feel as the need to be there the whole entire time. Because I feel better when I actually get sleep. So, yeah, I mean, it's okay. And it's like you said, we're approaching cold and flu season, and we need to
Mhm.
keep our bodies
Mhm.
healthy, and take breaks away from the screen and all that stuff.
I think that question about taking naps, I mean, it's important to take naps if you need it, but really you should be getting enough sleep for, getting a 7 hour. There's a whole point to doing 7 hours at once because you go cycle in and out of REM sleep, and REM sleep is important to restore restoration of the brain. So there's some significance to having a big chunk of sleep. You see people only sleep 4 hours a night. They tend to, or these workers, night workers, or somebody who's up at night doing Twitch, that there's some huge impact on the body there. But there is research on that, and it is important to get sleep at night when we're supposed to, when it's dark. There's a whole rhythm in your brain, and it connects with everything else. How you eat, how you think, everything. So important.
I feel like that's a whole other topic that we could do.
It's We have so many topics to talk about. I think we need votes on what we should be talking about.
Yeah. Bard asks, nap should be 20 minutes, correct?
I have no idea. I nap for 2 hours sometimes on a weekend, and that is to catch up on sleep. So I don't do it all the time, but I think if you need naps, you probably are deficient in sleep. If you need more than 20 minutes, go for it. But I've done cat naps. I'm not bad at cat naps. Amanda, do you do cat naps? I've done cat naps where you just like
Yeah.
zonk out for 20 minutes and you wake up
Yeah.
and you feel refreshed. They do say that it helps. It helps restore you.
So there was a time where I was working two jobs in the same day, and I would work like a morning job, and then I would like take a nap and then go and work my evening
Yeah.
job. Um, and yes, it did. And I would be able to sleep for like a good solid like 15-20 minutes, but I still felt tired later on.
Yeah. Yeah. I mean, if that's what you get, that's what you get.
Yeah.
20 minutes is good. It will give you enough restoration to keep going on.
Hmm.
Um, One thing I've noticed is I've been meditating for the last 3 months, and that's really helped with my sleep. Somebody mentioned calm, calcium, magnesium. That's excellent. A lot of women are magnesium deficient. Magnesium is really important to a lot of cellular functions, so that's a good thing. It's great for the digestive system as well. I don't know if anyone's mentioned anything else. I'm just looking through the. Wow, everybody really likes this topic. We're talking, yeah, yeah, having two little kids. I think Laura wrote she has two little kid boys, and that's tough. Being a young mom with babies, I've seen pregnant patients, and they're having, they'll be pregnant for the third time, and they have two little kids, and they're pregnant, and they're having trouble, resting, and so that's it's really hard on the body. And so getting sleep when you can is important. And again, I think the younger body is able to recuperate, but as you age, you're going to need that sleep time, that dedicated sleep time at night.
Anybody else with questions? We're gonna wrap up soon. We've been discussing this almost for about an hour or so. Yes, meditating is amazing. Um,
And meditating does come in many forms. So you
yes.
don't have to be, you could
Mhm.
just sit here and close your eyes, and that could be meditating comes in many forms. So
It's something that I'm
absolutely.
discovering and like really interested in. Um, and I do it in the morning sometimes, at night sometimes. In the middle of the day before I go to work, it's really 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 helpful. And
Yeah.
I mean that's a whole different other discussion, but it's very easy to do. I mean, you can find it just like on YouTube. You can find an hour to 2 hour
Mhm.
meditations. You can do a 10 minute to 15 minute. That's what I used to like.
Mhm.
Um, yeah, so it's been great. Vard had a question about chia seeds. What did you ask? Vard,
Chia
about chia
seeds.
seeds? Let me go back here.
I'm looking too.
He asked, are chia seeds good for cleansing the gut?
I don't know if it's good for cleansing the gut. Chia seeds have, if I'm correct, have omega, so they might be good for actually cholesterol. But I'm sure they are good for the gut. Vard might know something more than me. So, um, and I don't know if they have any fiber. So that things that are good for cleaning the gut are fiber foods. So, chia seeds are those gelatinous sort of. They're kind of. So I don't know if they have fiber. If they have fiber, they're good for the gut. So anything with fiber, your oatmeal's good. Fruits, vegetables. If you have issues with going daily, that's got to be a whole nother talk about. We did the gut one already, but going daily is important. If not twice a day, fiber. You need more fiber in your diet.
Fiber, yes. When I used to work on the weekends, it was like my go-to routine, having oatmeal every morning. I like oatmeal. It's good.
Oatmeal good. It can raise your sugar level. It depends on the person. So, but in general, for most people, I would say it's much better than cereal. Do not eat cereal. My kids loved cereal, but I think I've finally rubbed off on them, and they just told me, oh, last month, we just don't want to eat cereal anymore. We know it's not good for us. And I was like, all right, I did my job as a mom.
Cereal. Yeah, I was never like a milk fan, so I didn't eat a lot of cereal growing up. My sisters ate a lot of cereal.
Yeah.
I actually kind of started eating more cereal as I got older, like Life, but that's pretty much it. Or like the granola, like flake ones, those. Terry Bear asks, what about cream of wheat?
I don't know. Cream of wheat is wheat, and it doesn't seem like it's very fibrous. So I would say no. I mean, I like cream of wheat. I don't eat it very often, but
I like cream of wheat too. I haven't had it in a long time though.
I grew up eating cream of wheat. So, but I would say if you're trying to avoid gluten, and I'm not a big fan. I don't eat. I haven't had cream of wheat in a long time because I'm not eating wheat right now because of gluten. But I would say, we want to avoid inflaming the gut. So I would say no. And when you're looking for cholesterol, so one of the big things for cholesterol is fiber, and fiber helps with lowering cholesterol. So I would say staying away from things that turn to sugar really quickly, and, having more fibrous foods or more heavy foods. If you can, I was just listening to a lecture, and the professor said, if you could ball up your grain with bread or whatever, and you could ball it up, it doesn't have a lot of whole grains in it. Whole grains are going to be hard, a little bit harder, and that's what's going to have the fiber in it.
Got it.
I think we should wrap up now.
Yeah. Well, thank you guys so much for being here and engaging in discussion. If there's something that you would like to have a topic on or discussion on, please let me know. Send me a whisper or hit up my DM on Instagram. We also always are posting things on our Instagram, the Lotus Integrative Health Instagram. That's going to be at Lotus IHN on Instagram. So please follow us. We're trying to get more followers. We do post something at least once a day, but it's always very useful or helpful or something to reflect on. So it's not like spam or anything. And, we are offering a promotion right now. Do you want to talk about the promotion that we're offering?
Right. So till the end of the month, we're offering $50 for 15-minute consult to get sort of basic vitamins, vitamin D, and kind of get an assessment of your health and things that you work on. Yeah. So it'd be a quick visit, but it starts you off on the right path and then helps you figure out if you want to move forward with us.
Yeah, so we do this every other Thursday. So I see a lot of you guys really interested in. Thank you guys so much for sticking around. Yes, I'm glad that you made it, Bard. I'm surprised that you're awake, because usually you wake up later, or maybe this is your weekend. But yeah, so we do this every other Thursday. Mark your calendars. I'm doing my best to post on Instagram when I'm on live now, because I know that the notifications haven't been working very well. But yeah, I mean, I love having this, between 20 and 30 people. Spread the word if you're interested. And then we also always have this available for playback. So we do have them. So if you are interested and miss an episode or a stream, definitely check it out on my channel. And yeah, any closing words that you have for us today?
Yeah, just, make sure that you're looking at your health and, figuring out if you're a risk for cardiometabolic disease, diabetes, hypertension, cholesterol. We didn't talk a lot about hypertension, but it's in the mix there with some of the things that we talked about. And, if you are interested in more health topics, you can also go to our website. I have blogs posted. I have been actually writing it. Some people are different kind of learners. Some people like to listen. Some people like to read. So I've been kind of taking some of the information from these talks and putting it into a blog to also just reach other types of learners and other types of people. So you can go back to my blogs. I have quite a few now, and it goes over various topics. And we'll be talking more in these live streams. Give us some ideas about what you want to hear about. I'm just talking about things that I like to talk about because I know they're important. I talk about them all the time, but I want to talk about stuff that helps people. I think in my head, I wanted to talk next time about breast cancer and breast health, because we know that's this month is breast cancer awareness. And I know I'm in that age group where I'm starting to see my friends get breast cancer. We want to prevent breast cancer, and how, just what do we do to maintain our breast health? I think talking about sex is always fun. We've got, hormones to talk about. We can talk about men's health topics. I'm sure even the women would be interested in that. We can talk about more gut health topics. There's so much to talk about. Every time we talk, oh, we should talk about that. We should talk about that. So give us an idea of what you want to hear about. But we will slowly cover everything. I figure every 2 weeks we're going to go on, and we're having so much fun doing this. I appreciate everyone listening to me. I feel blessed. I think we're helping people, and that's what I feel like Amanda and I were meant to do. So we feel blessed. We feel blessed.
All right. Well, thank you, of course, for all of your help. And thank you all for hanging out. It's so fun to try and, view new things on Twitch. So thank you guys. I hope you guys have a really great day. I might go on tomorrow. I'm thinking about doing something before the festivities of Fridays happen, because it feels like Fridays are like the party nights now. So probably going on. And Anil, what are you doing? You were in here the whole time? Anil is our Twitch extraordinaire. What's up? Yeah. All right, guys. Well, again, if you just joined us at the end, or if you were here and came back, we will have this on my channel. So please check it out. You can share it. It's public to share too. So if you know anyone that's interested in this. And yeah, thank you guys so much. Have a great Thursday, and we'll see you soon.
Have a good week, guys. Take care.